Welcome to Smart PT. My name is Jonathan Reimer. Today I'm going to be talking about the various causes of muscle pain. Sometimes a muscle strain is just a muscle strain. However, in my experience, there are a large variety of reasons for muscle pain, often more common than the muscle strain mechanism itself. So for the purposes of this discussion, I'm going to be talking in terms of a common diagnosis that we see, lateral epicondylitis. And I'll talk about how the various sources of dysfunction can cause lateral epicondylitis type pain. So the first that I see very commonly is from a central neuropathy. So in the case of lateral epicondylitis, we may be dealing with a C5-6 dysfunction affecting the C6 nerve root, which is the dominant nerve to the lateral muscles of the elbow. So one of the things we'll see when we see early signs of neuropathy is we see tension and trigger points as well as a decrease in proprioception develop, long before we'll see things like dermatome and myotomal and reflex changes. That is the perfect storm for injury. So if you have an activity that you're frequently using those muscles with an increased level of tension and a decrease in proprioceptive activity, you have the mechanism for a potential injury there and a difficult process to recover from it. We may have issues of altered alignment. So in the example of the elbow, we can have an abducted ulna. Again, amenable to the manual therapist. The abducted ulna alignment will shorten the lateral epicondyle muscles or the extensors and potentially lengthen the flexors on the medial side. So it can be sometimes sources of pain on both sides. What happens with that is you create altered length tension relationships. So the altered length tension relationships, as we know, either result in not enough actin being able to grab the myosin in the case of an over-lengthened muscle, or enough actin grabbing but not enough myosin to create a strong contraction. So the change in length tension produces a disadvantaged muscle activation pattern that can result in soreness developing. That abducted ulna or potentially a dorsal lunate can create biomechanical blocks to proper movement at the arm, and I find that often results in muscle pain as well. So in the example of a dorsal lunate, you may have a restriction into extension, and those extensors are having to work quite hard against that block and not being able to move that joint through the full range of motion. So over time, they may also get shortened for that reason because the joint's not moving through the full range of motion properly. Muscles may also get sore because they're protecting an underlying instability. So you may have an instability at your wrist or your elbow, for example, that the muscles are overworking to try to protect. So that's another potential cause, also amenable to the manual therapist. And finally, you may seek patterns of compensation where the muscles are acting or overacting to compensate for one that's shut down or for a significant imbalance. We often see that in the core more often than I would see that in the elbow, but it's another thing that I look for. As a manual therapist, we expect that you'd have the palpation skills and knowledge to be able to identify and correct those imbalances. So as you can see, many causes of muscle pain. Not always just a simple muscle strain mechanism, although we diagnose strains all the time. I don't think it's incorrect in many cases, but we have to look for those underlying reasons and address them if we're going to be a smart manual therapist. Thank you for tuning in. Talk to you next week.